So we'll go around the table and we'll have the first input from all our panelists as we go around. And the first question that we want to address over here is that based on the expertise that they all bring, which is the healthcare project or program that they ran and it went really well, it gave good outcomes, and how is it that it gave a good outcome? We're talking specifically healthcare here and specifically CSR and government synergies. So let's start with.
So at Cognizant Foundation, under the healthcare initiatives, we have a program called Care for All, where we support maternal and child health initiative. And I want to quote two specific examples. One is more of a system strengthening kind of an initiative undertaken with the Committed Communities Development Trust in Bhiwandi and Malegaon in Maharashtra, a 5-year maternal and child health project. The paradox of Bhiwandi and Malegaon, despite being close to healthcare infrastructure, is low immunization rates and the antenatal coverage at a very low percentage. So the idea was to see what is the systems and the infrastructure that is existing and prevalent in these two locations, and then work to strengthen it. So in that regard, for example, better service delivery by the health post in those locations was something that was chosen as one of the initiatives. Apart from that, working with the community, the healthcare workers, ASHA and Anganwadi workers, and how to utilize their time better to make sure that there is an uptick in several indicators. So as part of that, I'm referring to some numbers here where we saw a 66.6% decrease in high-risk children, a 32% increase in children's routine immunization, and a 1,095% increase in colostrum feeding. And the institutional delivery, given that it was an area with a large migrant population and a Muslim community which still had certain home deliveries, that increased from 84 to 93%. So this was an effective collaboration in our view, wherein the idea was to strengthen work with the government healthcare system to improve certain indicators over a period of 5 years. And then another example that I want to quote again in the maternal and child health space is the project with ASHA Foundation in Tiruvallur district in Tamil Nadu. And it specifically looks at the districts and few panchayats within that district. Here the approach was twofold. One is to look at the infrastructure that exists within the district hospital. It's attached to a medical college, and strengthen that in terms of the equipment so that better service can be provided. And second is to upgrade a primary health center. So this was from an infrastructure perspective. Now from a systems perspective, there is a village health, sanitation and nutrition community. Unfortunately, it was not very active, although the committee was existing on paper. So our NGO partner worked with the local panchayats to actually revive that particular committee, which is an existing system, but it was not performing its role. In fact, to recollect, when we conceptualized the project with ASHA Foundation, we kind of stepped back and realized that we shouldn't be doing something without the active involvement of the National Health Mission. And therefore, we had to pause the start of the project by almost a year to make sure that crucial components that are recommended by the government, and they gave valid input on how to work at not only at a hospital and district hospital and a PHC level, but also to look at from a community angle how community volunteers could also be engaged apart from strengthening the existing deactivated committees. So the good news that came in about 10 months ago was a significant reduction in the maternal mortality rate, while the state average is 39.4 per lakh deliveries. In Tiruvallur district, it reduced to 26 per lakh maternal mortality, and infant mortality, which is 7.7 per thousand births in Tamil Nadu. In Tiruvallur district, it is 5.7 per thousand births, the infant mortality. So these are two examples that I wanted to quote where from a systems and from strengthening the existing practices are some of the specifics that I wanted to share.
Yeah, I think a very pertinent point over there that, there is a system that is established, but there is some strengthening that's required. And, instead of working parallel, if we can work towards the same cause, much like this, actually, these are really commendable. I think bigger round of applause. Maternal mortality is something that plagues our country, and, this kind of work is what improves those numbers. There is another thing that plagues our country, tuberculosis, right? And when the Honorable PM and the President made a call for TB Mukt Bharat and TB Nikshay Mitra, we found a similar opportunity. And those of us who are doctors and those who've seen TB patients know it's very easy to tell a TB patient take treatment, but he will go off treatment because of the side effects, especially if he's not eating well. And if he is the only breadwinner, he cannot even earn to eat. So we tell him, have high protein diet. How is he going to get high protein diet? And that is why if any of you are not registered for that, that's a very good program wherein, we support nutrition and give them high protein diet. And you will see miraculously all these TB patients just recovering. Their BMR improves, they respond to treatment, they go off treatment. So I think this point of finding a gap or finding an opportunity in the system where you can contribute and work on one number, like them chasing the maternal mortality rate or infant mortality rate. You have to chase any number which is dismal for the country and how we can, bring in synergies. So thank you so much for all the good work. Thanks.
Good morning, everyone. So thanks for your insights. So I represent a company called CDSL, and I take care of the CSR there. And the question here is that, what work we have done along with government and, implementing partners to have a clear impacts. Now, there are many examples. One of the, key example which is coming to my mind is we work with an organization called NHCT. This is Narayan Hridayalaya Charitable Trust. So I want you to think of it like a triangle, and on each vertex there is at one end of the vertex it's the Narayan Hridayalaya hospitals who are providing subsidized surgeries. Then one end is the donor who's actually providing medical expenses for underprivileged people, primarily in the tertiary sector. And then third is the actual this organization NHCT who's also contributing. So usually what happens is when a medical expense of to an extent of a surgery or say cancer treatment happens, the money which is given by government and various organizations, even if you subsidize it from hospitals, it's not enough. So you have to kind of put in money from all the angles. So there's some money which obviously the patient will put in, which is in the center of a triangle. One side we provide, and the hospital gives subsidy, and then charitable organization. In this, so what worked for us is that the organization is not charging any admin expenses, so that takes care of that kind of expense. And till now we have treated about 500 and 600 children for cancer and various life-threatening diseases. So this is one example. Apart from that, I mean, one more key example which comes to my mind is that what we do, I think thanks to CSR box, they kind of come up with a report. We kind of see the need assessment, what are the statistics, what are the states, border areas where, the CSR need is much, the intervention is not there. So in the past few years, we have deployed, medical vehicles from Smile on Wheels. And one is given in Jaisalmer and one in... So these are aspirational districts where, the primary healthcare may be there, but not to a significant extent. So there, we have provided our vehicles. And the collaboration here works is that we get to know of the real aspirational districts. The partner works with us. And even in the times of, landslides and floods, says, these vehicles are rerouted for, the action.
That's excellent. Round of applause, please. 500 little bachus getting treatment. there is always a little extra that's required, because sometimes the funding is it has to be, it cannot be customized, right? So there has to be certain funds which are available and the grants are there. But in any particular treatment, sometimes a little extra is required to actually get the necessary clinical outcomes and use the right tools and the kind of surgery and the kind of drugs. And I think that's really commendable to pitch in where the need is really good. And I think the point on aspirational districts is something which everybody should walk away from the room with. We also took a similar pledge, and over the last 3 years, we have supported at least 80 aspirational districts, and I'm really proud of that. So I think where the need is the maximum, there is where you have to go. I mean, there's no point in feeding the king, right? So you have to go and actually help where the help is really required. So I think you have to go and find that help and plug it.
Hi, good morning, everyone. I'm Megha. I represent Concord Biotech, and healthcare is one of the key verticals what we work on. And as a part of the healthcare that we look after, our aim is to make primary healthcare accessible to everyone, especially in the rural areas. So for the couple of projects, what we are working on there is, like Vinay said, we are also working on a lot of mobile healthcare vans which provide healthcare at the doorstep to a lot of these villages. But the second project what we worked on, where we are seeing a better outcome, is enhancing the existing facilities which are already there in the villages. Them being the Anganwadi centers, in terms of educating them and, for best practices, and upgrading the primary healthcare centers which are already there in the villages. We realize that the infrastructure and the setup is already there, but they are relatively outdated in terms of the equipments and in terms of the skills of the people who are working there. So the project what we worked on, and we are seeing a bigger impact, is when we are upgrading them, the existing healthcare centers, to better equipments and skilling the staff there. So, then the people get the access already there. So that is the project where we see working with the government in enhancing the existing setups is creating a bigger impact from what we are seeing. And we see the number of people visiting the healthcare centers also increasing once they realize that now, they also are equipped with all the modern facilities and everything.
Yeah, that's again a very, very pertinent point, and something that the WHO drives very well. The whole system of primary healthcare, secondary healthcare, tertiary healthcare, all of this becomes very important. And again, the second important point of skilling, that person may be there, but, some skilling deficiency is there. And if you can just upskill that person, he can actually help many, many more people. And the reach and the impact of that program will obviously become much better.
Good morning, everybody. This is Shauri Reddy from Bala Vikasa NGO from Hyderabad. We are into multiple community development activities, and health is one of our major activity. I'm very happy to be part of this panel, which is discussing a very important topic, the synergies between government and corporates. Why it is important is government is serving the poorest, right? No rich people go to the government hospitals. So if we help the government hospitals, it is like you are directly helping the poorest communities. And what we observed working with government hospitals is the government doctors are very capable, committed, empathetic, but they are handicapped to serve the patients, right? The reason is, the people going to government hospitals are more in dangerous cases sometimes. Private hospitals will not take care. They take care. They go to government hospitals. But, the government is handicapped. So realizing this situation, we have initiated different kind of programs with the government hospitals. We do our own health programs independently, directly, but we also work with government institutions. So we do 4 different type of activities. One is providing infrastructure. Sometimes they don't have sufficient rooms, right? Construction of the buildings. That is one thing we did in 3 hospitals. Another one is providing equipment, the machinery, right? Especially during COVID time, when government hospitals at the district level or the block level are suffering or struggling to provide the COVID care services, we provided 120 ventilators to 12 different hospitals who do not have ventilators. COVID time, ventilator is very crucial to save the lives. So we provided 120 ventilators to 12 different district level hospitals, and we also provided 1,500 oxygen concentrators, because oxygen also was very, very crucial thing during the COVID time. So that saved a lot of people. And another activity what we provided is providing clean drinking water in the hospitals. Because when patients come, they need clean water. And when the attendants come, they also need some comfort or some clean water. So we provided water purification systems in hospitals, and we had two models, where we have our own operator who charges 1 rupee per liter, which is purified and chilled, right? And we have two hospitals where the local collector said, or the minister said, no, don't charge, let us give free. And my experience, where we give free water, they are defunct in 2 years. Where Balavikasa is managing by charging 1 rupee per liter, purified and chilled water, they are sustaining and they are serving the best quality water to the community. See, one problem working with governments is the sustainability, the maintenance, right? So we need to be very clear in our sustainability models, designing in a way that they will work in it. And another one is we have provided ambulance. We have government ambulances which bring the patients to the hospitals, 108, free of cost. After you are treated, going back home, you don't have a facility, right? Or to bring the dead bodies or whatever it is. So we have ambulance services in Warangal, where our headquarters is, where we provide very minimum cost. Like, we charge only the diesel cost and provide the ambulance. So like this, we have 4 or 5 different activities where we equip the government hospital. For example, we provided one equipment called CRRT. That is the first equipment in the entire Telangana where government is possessing that. Before we provided, no government hospital have that kind of equipment, which is specially used for dialysis in cases. So like that, equipping government hospitals is providing dignity to the patients, care to the patients, and satisfaction. Similarly to the doctors also, right? By having the required equipment, they feel capable, confident, and then satisfaction of providing better service to the people. In that way, we are very happy to collaborate with government healthcare centers, support of corporates.
Yeah, I think that's really nice of you to do that. Round of applause, please, for the gentleman here. And actually, you brought back my internship days, rural internship. My entire pocket money used to go in this, because there'll be an equipment, but there won't be any batteries. There'll be a drug, but we used to face, I don't want to name the hospital and the village, but it was very tough times, because we used to experience everything from a snake bite, dog bite, lightning struck, all kind of things, but those things were not there. Or sometimes there were certain equipments needed, as you correctly said. It may be something very small actually, but it may really be important. And I'm telling you, most of us young doctors just go out and we just buy it ourselves, because we can't see a patient dying in front of us, or just getting neglected, or traveling 5 hours away to just get that facility. So this helping the government hospitals and the rural health clinics, primary health centers, is actually a very important area. But then I would, if there is some government person sitting over here, I think they should take cognizance of the fact that why should somebody have to go and plug that? Because very often we would see the equipment is there, but the what is required inside the equipment is not there. So I think, the thing has to be alive and kicking. And if there is so much automation, there has to be an automation by the government to see that whatever equipment they've placed everywhere, are they even functioning? Because you come to know today if something is off or on, right? And if nobody has worked on it, that means it's just there. So I think that's something to take home too. But thank you for your efforts. Yeah.
It's a pleasure to be back at CSR Box to be part of this panel. I'm Narendra Kumar. I represent Chola Finance. Been working for some time on healthcare, amongst other things. So I'm really happy to see all the efforts that are my co-panelists here in the room, and earlier in the morning we were discussing. But the scale of our challenge is just ever increasing. Like for instance, we just took out some data. In 23-24, the CSR spending on healthcare was about 6,830 crores, right? But the actual allocation by the NHM during the same period was about 33,000 crores. So which was huge, you know. So in spite of all of this, the last mile connectivity, while government can provide the infrastructure and all of that, the last mile connectivity, ensuring that nobody is left behind, has to be done by corporates and NGO partners like Mr. Shauri referred to. So Chola has been doing projects on healthcare, and our significant spend goes towards healthcare. Some of the projects that I just wanted to highlight are rural eye health, where we work at Saraikela, Aurangabad, Sirohi, Nabarangpur, Sambal, and Kawarada with the local, panchayats and local health bodies. We in that project we intend to reduce the backlog of cataract surgeries and which is something which we're working on. Another part of it is the Rahi project for the commercial vehicle crew members in 22 states along the Golden Quadrilateral. That's where we've opened physical centers to test eyes. We've screened so far over about 7 lakh truckers. We've distributed over 3,25,26 spectacles, 16,000 plus cataract surgeries. All of this leads to improved road safety, so that we realize that these guys don't have access to healthcare. These guys don't, half the people who are driving, they can't see really. It's a sad reality of our country, and these guys are moving trucks and wealth across the country. I mean, we need them, but we're not taking care of them. So this was one area. What we also thought was, instead of doing individual projects like this, we thought we will do a holistic approach towards this community and extend healthcare support for them, for their families. So there was this Gift of Life project in Chhattisgarh, Haryana, Maharashtra, where we've aligned with the local hospitals and we support congenital heart surgeries for children from the commercial vehicle crew community, because these surgeries are expensive, and we don't have access to this surgery, and insurance companies also don't cover this, and many of them are not covered. This community is not covered by insurance as well. Mamatava project, again with the local health departments, where last year alone over 1,100 mothers and newborns were supported, reducing maternal mortality rate. Shruti was another project in Odisha, where we are working with the Odisha state government, and close to 11,000 beneficiaries were treated for hearing loss. All of these are just not numbers. These are lives transformed, families uplifted, and communities strengthened. And this contributes to the overall growth of our country. This is why we're doing what we're doing. And one other point before I would like to pass on the mic back is that we have to move from curative to preventive as well. So this cannot happen only as a curative model. This has to be a preventive model, and this cannot happen in silos in healthcare. This has to work along with upskilling the ASHA workers, the health workers, funding more research to create more technology, digital AI stuff, and also in terms of we'll have to look at skilling, education, and WASH. So see, unless you do you support WASH, like water, sanitation, health projects, that's going to lead to more cases that are going to go and hit the hospitals, right? And that's going to burden the overall system. So we'll have to kind of go back to the roots, identify the root cause of this, and work on it.
Yeah, so thank you. Round of applause for the multi-speciality impact, right? So they've worked on hearing, eye, maternal mortality, cardiac. I mean, like across the spectrum, we can see multi-speciality clinical impact. So that's really nice. Okay, so now we had a good round of what went well, where there was significant impact, and we have a nice story to tell. I think for every success story, there's also a story that doesn't go that well. And I think that's also very important to realize. And I would really urge our panelists this time to suggest some really innovative implementation models or some strategic sustainability models or some very unique synergistic models which will actually help us overcome some of the problems that are there on ground and make a wider impact so the statistics are not so alarming next time they are called out.
Thank you, Dr. Kirti. While in the previous example I quoted maternal and child health, I want to shift to avoidable blindness and specifically retinopathy of prematurity. In our experience, not many corporates and foundations are supporting it, although there are a lot of on-ground implementation partners. Retinopathy of prematurity is a condition that affects preterm babies. Because they're born too soon, the blood vessels in their eye wouldn't have developed to an optimal level. Which means that about 25% of the preterm babies have a risk of this condition called retinopathy of prematurity or ROP in short. And those 25% preterm babies needs to be screened, or rather everybody needs to be screened. 25% may develop ROP. And about 5 to 7% of them need treatment in the form of injections, laser or surgeries. And we have partners in the form of LV Prasad Eye Hospital, HV Desai Eye Hospital and Pushpagiri Vitrio Retina Institute, Dr. Shroff Charity Eye Hospital here in Delhi NCR, etc. So one of the projects that we support is with HV Desai Eye Hospital in Pune and Satara. Now, this project has been running for about 4 to 5 years. Yes, every year there are a set of children, preterm babies that are screened, some percentage gets treated. So we are enabling that child from preventing the lifetime of blindness, right? All great. But how long can we continue in that mode? And that what started the thinking process to actually conduct an event in Pune about 4 months ago. We called it National Consultation on ROP. And we called out, Professor Rajvardhan Adad, who's the president of Indian ROP Society, Dr. Radhika Tandon, who heads the Rajendra Prasad Ophthalmic Center in AIIMS, Delhi, and various medical professionals like Dr. Anand Vinekar from Narayana Netralaya, Dr. Tapas from LV Prasad Eye Institute, and many other doyens of the avoidable blindness space to come together to discuss what we need to do as a policy suggestion, as an advocacy kind of thing. First of all, it is not mandatory for the government hospital setup to screen all preterm babies in the NICUs, SNCUs at birth. It is very sporadic. That is because the government system is not having the capability in the form of doctors being able to screen and treat. Screening, yes. Treatment, very, very tricky area. So how do we actually increase the capacity? So that started a chain of actions to look at our project in Odisha, where we support about this program, ROP program, in about 15 districts in Odisha. To look at one of the things, apart from screening and treating, the partner should actually train the government doctors in performing the screening and treatment. So that was one thing that was happening. Second was we decided that maybe we need to take steps towards building a national portal on ROP. No work has started, but the wish is there. And also to institute or rather reactivate and strengthen the national task force on ROP, which is supposedly there but not very functional. So these are some of the suggestions and ideas that came out, because we decided that we could continue doing this in the same style of screening and treatment, and we'll record 1,000, 10,000 and so on and so forth. But we need to change direction and take on a role of a systems enabler to be able to reactivate, strengthen, build capacity. And so that's the example that I wanted to quote.
That's a great example. You break the vicious cycle and you go to the root cause and actually try to bring in a policy change, which is going to reduce the problem rather than to just keep on, solving the problem. Great. Thank you. Yeah.
Thank you. Conscious of the time, I'll just make it quick. So I think one area where, all of us can collaborate means donors, the government, and the CSR partners is on the mental health front. So currently what I've been given to understand is the total health budget, and if you compare it with the mental health budget, it's less than 1% of the total, health budget. So, I think consciously we have to do something so that, the focus on this aspect is also increased, primarily because if your mental health is good, you will be able to execute it better. So I think, involvement of a lot of psychologists, psychiatrists, that capacity building should be done. That is one point which comes to my mind. The other thing is, again, as per the statistics, the right doctor to patient ratio should be 1:1,000. But I think in India, it's not so good. And more than that, it's unevenly distributed. And we should work towards, creating a conducive environment where medical students, stay in India, and facilities are such. In any case, Trump is making difficult for our students to go abroad. But, that is something which we need to work on. Lastly, by 2047, we'll have one of the largest population of, senior citizens. So, from a government perspective, tax incentives on, say, medical premium, affordable, medical surgeries, that will be, a good starting point so that we are ready for the next 25 years.
Excellent. Geriatric health is something which a lot of countries have taken head on. But, India has to still a little, realize that there's a geriatric population over there which needs special attention. Mental health, absolutely. There is a dark web over there which is spoiling everybody's minds. And that's important. And third is the doctors. So we run a beautiful program called MedEngage, where we nurture young medical talent. And absolutely, we need not only more doctors, but we need them better trained, better supported, so that they can then, impact more lives.
One thing which we noticed when working with a lot of implementing agencies who work across the country was there are a lot of successful models of public-private partnership which are already running in one state. We can try and replicate that in the state where we want to intervene, so that it's anyways a successful model. We don't have to start from scratch. We can bring those good aspects and work and improve overall on that front.
Yeah, actually, this should be published. I mean, the point that you're making, we have to replicate rather than reinventing the wheel. And if, it can be publicized, these good models, and then more and more people can adopt them, then, it really helps.
So as a strategy, I think the corporates who are trying to work with government, we have to question ourselves, do we support infrastructure or equipment? What is the priority? For me, it is the equipment which is the priority, so that, the doctors will be really equipped to provide better services. Otherwise, you are asking the army to get into the war without weapons, right? So this will be one good thing, but we have to be cautious. Sometimes some hospitals in some big cities where there are many corporates, they are overfunded, right? They have extra equipment because company want to give, they're just giving without saying do they really need or not. So for this, I don't know if any government officials here, please prepare an inventory of the district level requirements so that companies can look into what they require instead of, duplicating it, right?
Yeah.
And providing equipment will be one good option for corporates. Sometimes, during the end of the year, you need to spend big money. And to spend big money to implement any community development program will be almost impossible. But if you see a list of requirement in the government hospitals, in 15 days, 10 days, you can procure and spend your,
Yeah.
right? So that will be one good strategy to work with the corporate, with the government departments. And one recommendation is, as corporates and NGOs, not only in providing health services, the best thing is to also look into preventive health measures. Because the more we look into preventive health measures, the better health situation will happen. I give one example of Balavikasa, where we provided clean drinking water in the villages, water purification, 3 rupees 20 liters. Everybody drink in the village and everybody enjoying better health, especially the fluorosis, all those things. And within 3 months, village is enjoying better health, and we established one enemy in the village. Can you guess who could be the enemy in the village? Where we have what is established providing clean drinking water? Can anybody guess who could be the enemy? Is the local doctor. 40% danda khatam ho gaya. RMP doctor. Because with the clean drinking water, right, less patients going to the doctors. So like this, if you can really look into the preventive health care systems. And I thank Chola for helping Balavikasa with the 300 water plants in creating the impact.
Yeah, when you spoke about equipment in healthcare, there are two important assets. One is the equipment, the machines that are there, and second is the talent, the man behind the machine. And these two assets really have to be treasured, and asset allocation and asset management is very, very important. And we should use technology over there to make sure that, And there is another very interesting thing, and I would urge more and more people to put, some money over there, that now is the time for the medical and the engineering worlds to come together and actually reduce the cost of this equipment and stop getting it from abroad. Most of the equipment comes abroad with heavy taxes, and now, I don't want to go into that area. I think we really need to become Atmanirbhar over here also and start manufacturing this medical equipment, medical kits, medical reagents, so that, we're not really dependent on the West for that. And only then will you be able to serve, the other India, which is kept away, the rural India, which doesn't get to see half the equipment or half the tests.
Very true, Kirti, because we realized that, the ultrasound machine, okay, which helps several, children prenatal, and so we realized that most of these all these machines come from overseas, and there's a huge tax impact on it, and there's the cost is huge, and there are so many issues in government regulations and stuff. So what one of the other projects that we're doing is in collaboration with the IIT, we're developing India's first indigenous ultrasound machine, which is like from the scratch. Like every component is being developed in India.
Great. Waiting for it.
So, while we've worked with government all across India and in many states, it's not always been easy. People, there's a lot of red tapeism, there's a lot of tu meme, that keeps happening. Some of the, if for the government representatives, some of the requests that we have is to create an updated real-time centralized CSR portal. While it is there right now, I don't think it's real-time. To help create state-level CSR cells that can have, regular stakeholder consultations, maybe once in a quarter or something, and, introduce us to NGOs, credible NGOs, and other partners. Transparency in fund utilization, while there's there is the form filing that we do, but, if there is real time, then it would really help. Also, there's one wish thing that we were thinking about. If, the government could help create a matched funding mechanism where CSR spends are supplemented by other government schemes, like for every 1 crore spent, if the government can also match, 50 lakhs, say.
Yeah. One point that you mentioned, again, I don't think many people are aware. That's a very important point about state level CSR meets, because people forget that health is a state matter. The policies may be central, but the execution is at state level. So until you huddle at a state level and decide what's important for your state and actually, help the pin code or the city or the district or the, wherever you are, which needs. So I think that's really important, that state level statement. I think excellent remarks from all our panelists on all the points. Big round of applause, thunderous applause, please.
Welcome Nupur Singhal, Senior Manager at CSR Box, to please facilitate the panel over here. Dr. Kirti Chadha, who's been a wonderful moderator for us. Yes, please, big round of applause. They've also been preparing for this panel, we know that. Mr. Deepak Prabhu. Mr. Vinaya Madan. Miss Megha Ray. Mr. Shauri Reddy Singareddy. And Mr. Narendra Kumar. All right, thank you so much to this lovely panel, and thank you so much to the audience as well for keeping the spirits high and also making the live vibe over here.